Hey, everybody. Welcome to Meddkit's Provider Spotlight, where every week we get to interview the most amazing private practices from all over the United States. Every week we have a new specialty, a different perspective, and a lot to learn, most importantly. So today I have a really awesome special guest for you, and I'm really excited to chat with you, Dr. Loren Isakson, and owner of North Star Allergy Asthma and Immunology P.A. So welcome, Dr. Isakson. Thanks so much for joining us.
All right. Thank you so much for having me, and I appreciate the introduction.
Yeah, you know what? I always try to make it sparkle here.
It comes through.
Well, we're very excited to have you. We're excited to dive in and kind of what I like to do in the beginning is chat a little bit about your origin story. I think people are really fascinated about what got you here, what made you want to open up your own practice. So tell me a little bit about yourself.
Sure. Well, my origin story goes back quite far, so I will sort of take it from maybe middle of the way. I do have a background in science and biotechnology and some other things, but as far as it relates to my practice, I used to be the medical director of allergy and immunology services out at MacDill Air Force Base in Tampa. I wasn't formally in the military myself, but I did work with them to help start that clinic from the ground up and get it fully functional. And we used to see children, dependents, active duty soldiers, etc. I did find I was there for just under 6 years, and I really enjoyed my time there with the patients. But I did find that it became a little bit repetitive, and there were some other things that I wanted to do. Weren't so many opportunities for clinical trials and a few other things that I have my eye towards for the future. So I decided, I would try to consider the idea of a practice, but I also have a lot of other business ideas. So I was wrestling with that for a little bit.
Mhm.
Uh, Ultimately, what I ended up doing is I started to do a master's of science in entrepreneurship at the University of South Florida Muma College of Business. And I was doing that at night while also working full time as a physician during the day. And as I learned over there, there's a lot to learn about running a business. So ultimately, I kind of came to the conclusion that maybe I can learn about running a business while the subject material would be allergy and immunology. It's something I felt fairly comfortable with. Of course, there's continuous learning in that as well, but it
Sure.
wasn't like I had to go out and learn an entirely new skill set while I also learned how to simultaneously run a business. And so I decided that I would sort of push myself forward, learn a lot of business ideas, apply that to what I'm doing to provide good patient care. And maybe a little bit further down the road, when my beard continues to get a little bit whiter, I might venture off into some other areas that are somewhat foreign to me. So that's kind of how it came to be. And, it's great. I know a lot of physicians really are concerned about autonomy, both in their schedule,
Mhm.
decision making. And I really enjoy private practice, despite all the headaches that come with it. I would take those. And when my daughter asked me to take a day off and volunteer a jelly bean field day, I can just close up the schedule and head on my way. So it's been a good decision for me.
That is awesome. I love hearing about your journey, how you've helped people that are serving our country, which is really important. I'm sure that was an eye-opening experience as well. But also, not enough people talk about what it's like opening up your own business and opening up your own practice and all the hats you have to wear that maybe you knew you were going to wear, and some hats you really didn't intend to wear, but here you are, right?
Yeah, definitely, definitely. You have to be resilient. You have to really embrace it and kind of keep moving. And I don't mind that. I like that kind of stuff. So suits me.
Yeah, absolutely. And so I'd love to dive in into, what you're really helping people with. Obviously, allergies, but like there's so much more that meets the eye. So what do you feel that people are commonly coming in with, whether it's something that is, by the book, really easy to diagnose to things that are kind of tricky and that you find maybe that's common, but a little bit hard to treat.
Sure. Yeah. I mean, I would say our practice keeps the core competencies in place like most other practice. So we certainly have our share of people who have sneezing near trees and cats and dogs and that kind of thing. We also see a lot of people with recurrent sinus infections, hives, asthma, eczema, food allergies, some drug allergies here and there. So it's all pretty straightforward in that regard. But we also, in our practice, lean a little bit more towards the immunology side, and I try to see things through the lens of an immunologist. And in that sense, I get to venture off in other areas that deal with immune deficiencies a little bit more, and in those in parallel sometimes have some autoimmune diseases. So I
Mhm.
wouldn't say I'm a rheumatologist by any stretch of the imagination, although I did quite a bit of rheumatology in my fellowship. So I feel comfortable with that area and co-managing, and I think that's a little bit maybe different than some other practices. So a lot of that kind of stuff, run of the mill plus, and then some, I would say.
That's really nice to have that background because there's things that you can see that you're familiar with, things that you can kind of blend lines a little bit to help your patient get better. So I think that's really fantastic that you've had that background and you've been able to use it to the best of your ability to help treat people. And would love to dive in about, your approach. What obviously you mentioned a little bit about how it's different, kind of the lines that you like to blend within medicine. But also would love to know, I know you do a lot via telemedicine. So can you tell me a little bit about that?
Yeah, definitely. And I would add to that also that our approach often starts with our patient population, which is a little bit different maybe than some other places, but we still have a fair number of folks from the Air Force Base and other military areas that reach out to me, some by name that remember me from some time ago. But before I did allergy and immunology, and before anyone does an allergy and immunology fellowship, you have to do a residency. And that residency is either in pediatrics or adult internal medicine, usually could be family medicine or med peds. Now, I personally chose pediatrics. I enjoyed playing video games with my patients and doing a lot of other things there. So that was my time before I did my fellowship. So I feel very, very comfortable with kids. And I would say that most allergists should feel comfortable with kids. And I think most do, but there are definitely some who kind of venture away from that a little bit. And I kind of think of allergy immunology almost as in quadrants. So on one side, you would have pediatrics versus adults, and on the other side, you have more towards the allergy side or
Mhm.
more towards the immunology side. The latter is often done in academic centers because you have to get involved in bone marrow transplants. But as far as my approach is concerned, I cover all four of those quadrants. I elected to do my fellowship in something that was very, very heavy immune deficient, and
Mm.
we worked a lot with the bone marrow transplant team. So I feel very comfortable across the board in all four of those quadrants. That being said, I also take the approach that I spend quite a bit of time with my patients, which is a challenge to do in private practice from an efficiency standpoint.
Mhm.
But I really believe in investing heavy upfront so that our future visits are maybe more of adjustments, and our efficiencies are gained down the road, and our patients feel more comfortable. They talk to me about more issues that might not otherwise come up. So I really try to focus on them. And to that point, you mentioned about telemedicine. So
Yeah.
I did that. I launched our practice right before COVID started, and then of course that happened. So we adapted very quickly. I'm pretty facile with a lot of different technologies. So we were able to cover all of Florida. Um, I'm also licensed in Georgia and New York.
Great.
Um, and certainly TRICARE is okay with me seeing patients for insurance in those states. And the rules change from time to time. But I have a pretty good swath of people that I can treat. And then we also incorporate quite a bit of technology. So we were sort of piloting an artificial intelligence scribe, and I also have sort of a remote scribe so that I can really focus on you, the patient, and not have to worry about writing too many notes and focusing more on the computer. And then it all makes its way into the systems, and patients have access to their data. We don't really hold any of that hostage. We really want to have open communication with our patients. So I think a lot of practices strive to get there, but I feel like we're doing a pretty decent job of that in our particular practice.
I love it. I'm really glad that you talked about the telemedicine portion because, I think some people have partaken in telemedicine. They really like it. They enjoy it. And then there's other people that don't know quite what to expect, especially when you are in a specialty and patient's not sure. So I love that, one, you take the time, to be with your patients. You have a scribe. You can really focus on, their patient care. So I think that's a fantastic way to kind of dive into my next subject is, people have a lot of misconceptions when it comes to healthcare. There's constantly buzzes going around, fueled by what maybe used to be WebMD. Now people are utilizing ChatGPT now, and it's good to some extent. It people are interested in their healthcare, they're interested in learning, but sometimes it can go too far. So I would love to hear from you, Dr. Isakson. What are some of the misconceptions that you feel like you are constantly debugging, or maybe something that you hear a lot in your field?
Yeah, actually, one that I really feel important to stress is oftentimes if a patient comes to me after a very bad allergic reaction, perhaps they've been seen in the emergency room, and they were prescribed an EpiPen, but they don't really know how to use it, and then they don't know when to use it. And one of the most common things I'm told by my patient is, well, I use it when my throat's supposed to be closing up, right? Or I can't breathe anymore. And I have to tell them that that's definitely an appropriate time to use it, but we don't want to wait until your throat is closed up until we use that epinephrine. And so I really spend a lot of time educating folks about the when to use an EpiPen and how to use an EpiPen. And we have some really great resources for that. But ultimately, it comes down to we want to have a lower threshold to engage in that. And I think we serve to make people feel more comfortable about that. I think the other really two interesting misconceptions that I get from patients and sometimes even healthcare providers is yes, we treat asthma and we treat eczema. That falls 100% in our wheelhouse. And a lot of people have told me, oh, I thought only pulmonologists treat asthma. And we have our asthma guidelines and things of that as well. And same thing, they thought dermatologists treat eczema. But those are 100% in our wheelhouse. We're super comfortable with that. And I'm comfortable with all of that from essentially birth onwards. So those are the top three that come to mind.
I love that. You did peak earlier in the interview in giving us some insight about eczema, and my light bulb went off, and I was like, I have to ask you about that later. So I'm so glad that you brought that up, because most people wouldn't think about that. They think maybe dermatologist, and going to see someone like that, but they don't think about the other implications of why that's happening, the root cause. And that's something that you're perfectly well adept to address. So I think that's a really fascinating misconception that people have, and definitely talks to the education piece and what you've learned, and kind of what we talked about earlier, and bleeding those lines of it's not just this; it's a little bit broader in
Oh,
terms of care.
yeah, well, certainly immunology is involved in every body system. I don't own, quote unquote, any one particular organ. So I have to think about it from the eyes all the way down to the toes to everything. So it keeps us busy and cognitively interested every day.
I love it. That's awesome. And kind of to round out today, something that I love to do is get some really great pro tips. And it's an interesting two-pronged question, which I think you'll enjoy. Just having the background that you do, starting a private practice, would love a pro tip for other practitioners that maybe are starting to open up their practice, or maybe they've had their practice for a while, and there's some things that you do within your practice that you're like, man, I do this every single day. It's so important to me, or something that I do within patient care that, really makes a difference. So, pro tip for practitioners, but also because you've had such great insight and really interesting insight in terms of, what you do and how you do it. Is there something that a homework or a pro tip that you could give to a patient, or just everyday people like us, that are just interested in how do I move my health forward, or if I'm exhibiting these symptoms, what do you think I should do about it?
Yeah, definitely. And I appreciate the question in the multiple directions. So, as far as a practitioner is concerned, I would say that it's really, really important to get out there and start doing things, whatever your things are, be it opening a practice or seeing patients or trying something new in your clinic. You want to get what I call real world data. You essentially want to test a lot of your assumptions in business. We used to have a saying in our entrepreneurship degree that your business plan is obsolete the second you finish writing it. Everything, it's a great guide frame. It's good for thought process and structure and framework. But when the real world kicks in and market dynamics happen, you really have to sort that out by doing things. So I would really encourage people to get going and figure out what works for them and what doesn't work for them. I think the other thing that I would say is, especially with telemedicine and a lot of digital health tools, I would say that I would try to partner with companies that don't force you into long-term contracts right up front. Perhaps a few months or month to month would be better. And the reason I say that is because everything looks fantastic in a polished demo, but all the bugs and bottlenecks really don't really show themselves for your particular workflow until you've been using it for some time. And
Yep.
then you don't want to get buyer's remorse. So it speaks to me when a company tells me, oh, we'd like to demo this as a pilot or a beta in your clinic, or maybe just month to month, that they really stand by their product or they're willing to learn. But if it's another product that's early on, and I'm not talking about things that you have to use as your core competencies, some of those you have to take a longer contract on. But really, you want to test things out and have the ability to walk away and no hard feelings on either side. So that's what I would say to practitioners is real world data and focus on who you partner with for vendors. As far as patients concerned, a lot of the education that we go over is simple stuff to elicit patterns. So, especially in food allergy, I ask them to keep a journal to bring awareness to things that they might not have otherwise thought about, and specifically to tie that together with activity. So it's really interesting. We have some foods that people can tolerate all by themselves, and we have those same people who can exercise vigorously without any issues. But there are some foods that if you eat them and then exercise within 2 hours of that, or conversely, had you exercised before eating the food, you might end up with a severe allergic reaction. It's kind of an interesting pathway. So I always ask my patients, if you've had a really bad reaction, I want you to back up to sometimes even 4 hours. Tell me everything you ate and what did you do exercise. And I also want you to put that at the +2 to +4 hours after the event. And then all of a sudden, we're able to sometimes pull out a number of different foods or perhaps preservatives, and we can cross compare food labels. And that awareness is really important, and it guides our testing to be history specific rather than just sort of shotgun a whole panel of 300 foods or something like that. So I think that's the biggest thing is trying to take a retrospective look on your life and figure out these kind of patterns. And that's one simple tool to do that.
I love that. It's something that I would have never considered. And that's why I love this question. And that's, everyone answers it so differently. And I love the new perspectives. But yeah, I would never thought that working out or getting exercise before I eat something I could be allergic to would have such a reaction.
Yep.
And I love the, just dialing back into what did you do that day? Tell them back up to 4 hours, and we're going to go line by line everything that you did, because that just such a small detail can make such a difference, and solving that mystery,
Yeah.
what that could come from.
So yeah, I think it's helpful. We try to implement simple things in the practice. Not everything needs to be expensive testing and fancy terminology. Sometimes just taking a book and a journal, bringing awareness to the forefront is the way to go.
I love it. Well, Dr. Isaacson, I think this has been so informational, so helpful to not only people that are, patients, but also practitioners that are listening as well. Would love for you to tell us where people can reach out, where they can find you, where they can learn more.
Sure. So our website is northstarallergy.com. It's all one word, North Star Allergy. We also have a Facebook page, an Instagram page. There's a couple YouTube videos out there which we might elaborate on in the future. We have our LinkedIn as well, and we're sort of ramping up some of our marketing efforts as we transition from our telemedicine focus. People can call our clinic the good old-fashioned way at 727-222-1879. Fax, the bat signal, whatever works for you. You're welcome to get in touch with us, and we're here to help you. I think the premise of our clinic, we say, is that we understand that healthcare is complex. I certainly don't overlook the fact that I myself have been and will likely be a patient someday in a complicated healthcare system. So I have that empathy, at least I'd like to think that I do. And we want our patients to feel treated the way that I want to feel treated in medicine. And North Star is really meant to be just that. We're meant to be a knowledgeable guide for you to get to where you need to get to. And we try not to be too prescriptive. We do the big term these days is shared decision making. I think we were doing that before it had that fancy name, but that's what we want. It's a collaborative approach.
Yeah, I love it. Thank you so much, Dr. Isaacson. This has been amazing. Definitely love the bat signal. That was great. Never heard that one. So I'm
Yeah.
Batman out, right?
Yeah, definitely. Same time, same channel.
Yeah, sounds great. Thanks, Dr. Isaacson.
Okay, you're welcome. Have a good day.
You too.